Everyone, and welcome to part one of our webinar series, Community Health Dashboards, Bringing Your Assessment and Plan to Life. My name is Eileen Aguilar, and I'm a public health consultant here at HCI, and I'll be your facilitator this afternoon. I know we have a very limited amount of time together, and we have so much information to share with you all. So I'll get right into just a couple of quick housekeeping items. You're all joined this event as an attendee, so you're automatically muted for the duration of the webinar. But if you have any questions for our presenters as they go through the slides, please feel free to type them in the bottom right-hand box of your WebEx window. We'll be monitoring your questions as they come in, so please make sure to select the All Panelists box when submitting them. It looks like we have a great group today, so we're really excited to see what questions that you have for us today. In addition to our speakers, we have some additional HCI team members who are supporting the webinar as panelists. We'll try to answer as many questions as we go through the presentation, and we'll make sure to bring them up during our Q&A session. I wanted to make one final note that there will be a recording of today's presentation made available to you all following today's webinar. As I mentioned before, I'm Eileen Aguilar, and I'll be playing the facilitator role. Now I have the privilege of introducing our two presenters for today. First off, we have Jane Chai, our community health subject matter expert. Jane has worked in community health for the past 20 years. Prior to joining the HCI team, Jane worked at the local public health department in Orange County, California for 15 years and was responsible for coordinating community health planning, strategic planning, workforce development, and quality improvement. Emily Hummel is a senior account manager for our client services team. She has her master's in public health, and she has been with HCI for over 5 years. During that time, she has worked with a variety of clients across the country to build and implement their community platforms, as well as working to improve their community needs assessment processes, strategic planning, and progress tracking. We're very lucky to have both Emily and Jane on our team here at HCI and as our speakers for today's webinar. For those of you who aren't familiar with who we are, HCI has been a leader in the community health field for over 13 years. We've conducted over 200 community health assessments and implementation strategies with partners all across the country. We also provide strategic direction for community health initiatives, and we're known for our award-winning customized technology platforms. Along with powerful analytical tools, our platforms provide access to continuously updated population health and socioeconomic data to help tell your community's story. Like Jane and Emily, HCI's employees bring both a combination of advanced public health degrees and a real-life experience in community benefit and population health. Now that we've introduced ourselves and HCI, we'll be turning our webcams off in order to maximize the audio quality of the remainder of the presentation. And so with that, I'll pass it on over to Jane to take a deeper dive into the objectives of our webinar series for today.
Thanks so much, Eileen. I wanted to note that today is the first part of our webinar series, Effective and Actionable Community Health Assessments and Plans. Today, we'll be focusing on how to ensure that your assessment is a living document that engages community partners and leads to shared action. In part 2 of the webinar series, which is happening next week, we'll be discussing how to both implement as well as track your community health strategies. So once again, for today, let's talk about our objectives for today. We'll be covering ways to use a community health dashboard to tell your community's story with meaningful data that help you identify local priorities and health disparities. Use local data and resources to enhance your assessment and plan. And finally, utilize the findings to engage community partners in cross-sector collaboration and shared action. So let's dive in. If you've completed a community health needs assessment or an implementation plan, you know how much work goes into the process and what a valuable resource they are. They are comprehensive, include so many important data points, strategic priorities, and give voice to community members and stakeholders. And at the end of that process, we typically get a final published report, which is a great accomplishment. But many of you probably know that there can be some drawbacks to having only a printed document or even a PDF as your final product. First, once that document is complete, you can't change it, even if something like a pandemic happens. And perhaps even more frustrating is that oftentimes the document ends up sitting on a shelf and is only really appreciated by a few people. In comparison, a community health dashboard is buildable over time, makes information easy to share, and can be a hub for community action, which is crucial, especially when you can't meet in person. So we want to acknowledge that for hospitals and health departments, there are regulatory and accreditation requirements that you might be working towards. So some of those are to ensure that your assessment includes a range of data, including health and social determinants of health data, actively engage with community residents and partners, track changes or progress over time, and sharing and making these documents widely available. So we know that it can be a challenge not only to do all of this, but also to be able to demonstrate it in your reporting. And this is where we think having a dashboard could be an essential tool by keeping your assessment updated, showing changes to your plan, and engaging community members and partners throughout the process. We also want to acknowledge that many of you may be representing a community foundation or a collaborative. So you might be conducting an environmental landscape or, I'm sorry, an environmental scan or landscape scan, which have many of the same elements of a CHNA or CHA, including demographic, health, and social determinants of health data, community input and stakeholder engagement, and identifying internal and external strengths and opportunities, as well as community assets. Environmental scans allow you to systematically survey and interpret relevant existing data to identify external opportunities and threats that could influence your future decision making. Again, a community health dashboard can be a great starting point for your assessment and that environmental scan. And we think it's really important to start with meaningful data. One of the first questions we get asked is, how much data do you need for a dashboard, and how do you choose what to include? The answer is really unique for each community. HCI's platforms include about 150 to 200 standard indicators, with some of our communities adding indicators and hosting upwards of 300. Our recommended approach for choosing meaningful data is to use indicators that help facilitate cross-sector or multi-department collaborations, track progress over time, and get to root causes of health inequities. We like data that align with state or national initiatives such as Healthy People 2030 because they're more likely to be tracked by multiple organizations and at different levels. We also think it's important to use reliable sources that are regularly published, which helps us track progress over time. And finally, we like data that's granular enough to show disparities. We find that this really is what informs local programs and policies. When curating data, it's really important to show data across the health equity spectrum. Oftentimes, data focuses on those indicators that are more downstream or on the right-hand side of the spectrum, such as mortality, disease, or risk behavior indicators. But because health begins where people live, work, and play, it's also really important to have data points that show living conditions, such as overcrowded housing or access to parks. Beyond that, data should address institutional inequities, such as differences in access to healthcare and unemployment. And finally, data should address root causes showing social inequities, such as gender pay gap, poverty, or hate crimes. Utilizing this framework, credible data is available from a variety of government, private, and local sources. These data are typically updated annually or biannually. So whether you're creating your own dashboard or using a vendor, It's important to update the data soon after the source is published so that your dashboard remains current. After you have this data, the next step is to use it to understand and prioritize the needs in your community. These are the types of data questions we typically ask ourselves to identify needs in our community. Are we doing better or worse than the state or the US? Are we meeting state or national benchmarks such as Healthy People 2030? And are things generally getting better or worse? And finally, which communities are experiencing disparities? A comprehensive community health dashboard should bring those data points together and answer some of those questions. Here's an example of a dashboard that shows values for various indicators in one county compared to state and national values, as well as general trends and Healthy People 2030. Having a range of indicators on a dashboard will help you tell a more complete story, including where the community is doing relatively well and where it's falling behind or trends are worsening. As I mentioned, many of our clients will have a range of 150 to 300 indicators on their dashboard. And then after reviewing this, they might have a smaller set of indicators that they're tracking over time for their community health assessments or for specific priorities. As you begin to see areas you want to prioritize, your community health dashboard can provide data and data visualizations to help you better understand disparities by demographics such as age, race, ethnicity, and gender. Of course, another way to look at the data is by looking at geographies. So your community health dashboard should also have the ability to map data by city, zip code, or another regional grouping to help show which communities may be more at risk. This is a map of households with internet subscription by census tracts. Areas in red and yellow are those with less access compared to state benchmarks, while those in green are doing better. So looking at this map, you can begin to see some patterns emerge about which communities may have disparities in access to internet. Another important part of having a meaningful dashboard is trying to look at an issue from multiple perspectives or data points. For instance, you're seeing 3 maps of a county from left to right. The maps are showing by zip code adults who are sedentary, adults who are obese, and adults taking medications for high blood pressure compared to state zip codes. So from these maps, you can really begin to see that the same communities that are at higher risk for being more sedentary are more likely to have higher rates of obesity and use medications for high blood pressure. We're not drawing any conclusions here, but looking at these data or any causal conclusions, but looking at this data in this way can help you confirm that the data makes sense and identify potential action points. And depending on where your community is at in terms of health equity work, you might go even more upstream and look at education, income, or housing conditions in these areas to identify areas for cross-sector collaborations. Looking at these secondary data sources or data that are captured by other parties is a great starting point for your community health assessment. But we know that most communities are also doing additional primary data collection to gain deeper insights or build off previous findings. Many health departments are themselves a source of data and may want to add data on reportable diseases, hospitalizations, or vital stats on the dashboard. This can be very helpful because that data is often more current than secondary sources. And many communities also conduct their own surveys that mirror questions asked by CDC's Behavioral Risk Factor Surveillance System, or BRFIS, so that they can get data at a local level. And some communities we know are conducting local surveys so that they can ask questions that aren't in BRFIS or other surveys, but are important to the local community. Whatever you're capturing, once you've completed the data collection, having the community health dashboard can help you put that local data into context with state or national data and help to track progress over time. There are also often other local reports completed by local agencies, including other hospital CHNAs or topic-specific reports on a range of issues. Your platform can be a great tool for building on your assessment or plan by including those reports. For instance, if one of your priority areas is maternal and infant health, and a local agency just published an in-depth report on substance-exposed infants, you can, with permission of course, link to their report. This really elevates their report as well as better inform your own assessment and strategy. So I'm going to now hand this off to Emily, who will be showing some examples of how some of our clients have put this all together on their platforms.
Thank you, Jane. Hello, everyone. I'm really excited to show you a variety of content and some examples on some of our clients' live sites today. Please keep in mind, I'm showing sites that are built using the HCI platform. So if you don't currently have something like this in place, just consider these examples when thinking about building out your own platform or shared site. So let me just toggle over here to our first site I want to show. I want to focus on this site because it's a great example of integrating local data onto dashboards, as Jane was just talking about. So we can see here, this is just a general dashboards landing page. So from here, it's really easy to find data, specific indicators on the site, searching by a keyword, by topic, by even location. And this group happens to maintain, I know Jane said some of our clients maintain upwards of 300, but this group, who's been a longtime client, actually maintains close to 500 of their own indicators across various dashboards. So they've done a really great job of honing in on the ones they want to group together in collections, as we can see here on this landing page. But actually, I want to focus here on this primary care needs assessment tracker, which I already have open here. This is a great example of integrating local data alongside other publicly available data. So this data tracker was specifically developed to assist policymakers, health planners, healthcare professionals, and community members in making assessments of relative health risks and primary care health needs in their community. Let me segue now to the next site I want to showcase for ways to use data to support a story around a specific topic. Here's a custom page that was built on the site using selected data and custom content to create what I would consider a one-page visual of sorts. It's an easy to read, extremely easy to navigate, and it's using graphics and data visualization to tell a story around a specific topic, as we see here on ACEs, or adverse childhood experiences, which we all know is an important topic, and especially one to this community. It's also important to note that having an easy way for data visuals to be downloaded or used externally off of your platform or site can be really beneficial for keeping momentum going for the story to continue to be told through other avenues. And I point that out because in this example, these data cards that are being highlighted on the page are easily saved as a JPEG or a PDF file by just clicking a button. I'm going to move on now to another site. Also using data to tell a story a bit differently is this site in Baton Rouge. Here I'm looking at a page focusing on Black Lives Matter, which is really important to this community. Another great thing about utilizing these platforms to tell a story is the ability to distill a very complex issue, such as this one, into a more simple message, and then bringing data in, as we can see over here on the right-hand side, to support that messaging or narrative. Consider how you may make it more interactive, especially with data elements or other resources, to see more details or context around a specific data element. If I click on any one of these, it actually brings me to an indicator detail page on the platform where I can see a lot more details, comparisons, and trend over time, and even breakout data for this indicator. One more site to show you all is another example to tell a story through data. This tool is specific to the HCI platform, but again, I want to show the significance and benefit of having the ability to communicate to various types of audiences. Looking at data over time by demographics can help show whether disparities are widening or narrowing. For example, this chart shows teen birth rates decreased overall between 2013 and 2019. Looking more closely reveals the fastest decrease. On the other hand, if disparities appear to be widening, it may bring more light to an urgent need to focus on a specific population as a call to action. The data visualization and storytelling can be easily communicated to a community member, used in a board or steering committee meeting, shared with a healthcare executive, used for grant purposes. I could keep going. It's also an excellent way to engage partners and stakeholders who may be even helping to fund the platform or collaborative work that you're doing together. I will also note that while we're using data, charts, and tables and other visualizations in this storytelling tool, they are easily exportable and can be used offline. And with that, I will turn it back over to Jane to begin to talk a little bit more about community partnerships.
Thank you so much, Emily. Yeah, as we mentioned, health equity is something that is really becoming central to our work. And part of that is the acknowledgement that to truly improve community health, we must engage with community partners, including those from sectors that work outside of health on issues such as racism, poverty, housing, and education. In its call to action for Public Health 3.0, the National Association for City and County Health Officials reiterated the call for cross-sector collaborations, shared data, and a collective impact approach. But it can often be challenging to figure out just how to do this successfully. We'd like to take a moment here to ask you to think about one organization or a sector that's critical for your organization to engage with in the next 5 years. Feel free to type this in chat if you would like, or just keep that partner in mind. So hopefully you have a partner in mind. And as you're thinking about that potential partner, consider what it might take to build that bridge for collaboration. Many of you probably have heard or used the collective impact approach. This is a model for different sectors to work together on a common agenda or specific problem together. And as you're considering your potential partner, you're probably already thinking about how you can put some of these elements in place: a common agenda, shared measurement systems, mutually reinforcing activities, communication, and infrastructure. You're probably seeing that a community health platform could be a way to build a bridge for collaboration and support the key elements of collective impact, including the ability to demonstrate shared priorities and common goals, use common data for measurement, amplify mutually reinforcing activities, and act as a hub for your infrastructure and communication. If your dashboard includes both health and social determinants of health data, such as income, housing, education, you'll already have some common data for a range of partners to use. Having a dashboard also makes it so much easier and honestly more fun to share the data. If you're a hospital that has prioritized chronic disease in your plan and you're hoping to partner with a food pantry, you might send a link to a page with these maps to begin a conversation. The map on the left shows hospitalizations due to diabetes, and the map on the right shows HCI's Food Insecurity Index, where the darker green is showing areas of increased food insecurity. If you don't have HCI's platform, you might share another measure like families living below poverty level. This might be the beginning of a great conversation about how these issues are linked and how you can work together towards shared priorities. Once you have your priorities, your platform is a great place to organize and communicate data and data visualizations about your priorities, calls to action, shared work that's already happening, and the progress that you've made together. I'm now going to turn it back over to Emily to show some of the ways that our clients have translated their platforms into shared action.
Thanks, Jane. Again, I want to acknowledge and just reiterate that I am sharing these platforms that are through the HCI system, that many of which have been around for some time. But once more, we just hope you will consider these examples to inspire your own work around a shared site if you don't already have one. Let me bring up our next site example that I wanted to show. This is a site run by a partnership which has succeeded at building and using a shared platform as a hub for their work. This page I'm now focused on is just one of their initiatives. The Healthy Northeast Ohio Partnership created a really robust page here to serve as a vaccine ambassador toolkit. The page is rich with information and resources, including a collection of COVID-19 vaccine readiness resources, clinic location, facts about the vaccine, videos that you can see here. And they even have a section that addresses misinformation around the vaccine. So again, just a really great way to utilize a shared space to communicate and share resources that are extremely important to a community. Moving on to another site, utilizing a platform to engage partners in their work is this website run by a local health council and 3 county health departments. They created priority pages for each of their focus areas determined by their regional health improvement plan. And each page has a goal, a link to actually view the entire plan if one wishes, metrics with a link to the current baseline data and targets, a page for why these measures were chosen and their importance, a collection of funded projects working towards each measure, with each project also having a featured page of their own on other parts of the site, and a link to apply for grants through the Health Council. You can search for promising practices, learn how to get more involved, etc. These pages demonstrate the need for each priority area, the goals, who is involved, how to get involved, and what they're learning as an attempt to collaboratively tackle the priority area. So there's constant evaluation and improvement and a lot of engagement. One of the nice things about having a shared platform is that partners are able to show updates and other related activities around a topic of interest. This last example here happens to be a site organized through a very large health system. But as you can see, as I hover over this Explore Navigation tab, they've created a page, actually a section, I should say, of their site for each of the facilities, because it's really important to them to have pages that feel very local and community driven, and for each region within their expansive network to have its own place to share and access local events, resources, news, etc. Scrolling further down, you can see priority areas related to this specific region, to their needs assessment, and how the data supports the goals and activity around these priority areas. Again, just a really great way to use a platform to engage with your partners and your community and communicate what you're working on and why it's important. With that, I will stop sharing and turn it back over to Jane to wrap up our presentation.
Thanks so much, Emily. Those are really inspiring, so thank you for sharing that. To close today, we did want to share one story that truly demonstrates how having a community health platform can result in action. This is a story about United Way of Southampton Roads, who used their platform to identify a 23-year life expectancy gap in 2 adjacent census tracts and a host of other issues impacting health, including housing, food insecurity, and mental health. Using that data, the city secured a $30 million grant from U.S. Housing and Urban Development for a redevelopment project that involved the health department and hospitals, businesses, community-based organizations, and others. And in their words, having the platform was a cornerstone of their work, providing their community with common language and data that they could act on. So we wanted to leave you today with some of the lessons we've gleaned from supporting so many community health dashboards across the country over the years. First, having data on a central platform makes it much easier to collaborate across sectors. When data on health, education, and income are in a centralized location, it helps partners find common data to work on together. Since most people are not experts in data, make sure your dashboard uses simple data visualizations that can help tell the stories behind the data. It's important to link data to action by allowing local partners to find local reports and resources alongside the data. And finally, we find that though there's a lot of interest in this work, there's sometimes still a gap in expertise. So you might need to invite experts who can provide technical assistance or build capacity around stakeholder engagement and strategy development. This could be done through a vendor, or you might trade services with a local partner agency that has experience in this area. So that concludes our presentation and will lead us to the discussion portion of the webinar. Please feel free to ask any questions in the Q&A, as Eileen had mentioned. And as you're thinking about or typing in any questions, I'll invite you to join us for the final webinar series, which will take place next week on September 16th, and focus on how to effectively develop and track your community health strategies. Eileen will be posting the registration link in chat for those who haven't yet registered. So thank you so much for doing that, Eileen. And for this part of the webinar, Emily and I will go ahead and turn our cameras back on. And Eileen, I know you've been collecting questions as we've been going, so please let us know what might have come in.
Yes, thank you, Jane. I do have a question. One of the questions, and maybe Jane, you can help us answer this, is how long does it take to build a dashboard?
Yeah, that's a great question, and I'll answer this. I think when Eileen introduced me, she mentioned that I worked at a local health department for about 15 years, and one of my roles there was in community health planning, doing a lot of this work, and I was actually an HCI platform client. Before we were clients, we did look into, building the dashboard, and from that experience, I know that we were quoted something from our IT department between 8 months to a year. So that's to give a little bit of background of what we were told. But I think, that was with the types of needs that we have. So I should start by saying, I think the time it builds probably depends on what your needs are and what your resources are. We really wanted a built out platform, something that was easy to use. We had said at the time about 75 live indicators. We got a lot more than that. And that was the quote we were given. For an HCI platform, and the reason we went with HCI was it could be implemented typically within 12 to 14 weeks. So that was much shorter time frame for us, and everything was live and ready to go. So the answer to your question is probably it depends. If you're looking for something small and you have a good IT department that thinks that they can launch something, it could maybe take a shorter amount of time. We do it within 12 to 14 weeks, but of course that's something that you might negotiate with your IT team. Hopefully that answers the question.
Great, thank you, Jane. We do have a couple more questions, and Emily, maybe you can help us answer this one. This one's related to the platforms. Do we have some examples of how platforms like these are funded?
That's a great question. It's one that we often get that keeps coming up over the years, and we've really seen a variety of approaches. So similar to a lot of the things that we've talked about in this webinar, it really depends on the community and the resources, the different partnering organizations that might be part of the group. So some clients, we know have been very successful in getting grants to support their platform, and that can be multiple years. Another successful way we've seen clients fund is through the shared approach through partners. So just multiple partners helping to finance the platform. And then another way to think about it is having, maybe there's a lead agency who has more financial resources, or a backbone partner who can be the financial support, while the other partners are supporting through ways of staffing or data support, for example. So it's really unique to each client's individual makeup and their partnerships and the resources that they have available to them. But hopefully that gives a little bit of a wide spectrum of answer to that question.
Great, thank you, Emily. We do have some time, so we have a couple more questions. And Jane, maybe you can help answer this one. Is there someone to help us if we need help with our assessment using these data and platform?
Yeah, that's a great question. So if you're using an HCI platform, our platforms do come with a dedicated account manager, and they have really experience on how the platform's been used by other clients in conducting community health assessments and CHNAs. And they're folks like Emily, who's amazing with an MPH background and with background in community health, who can help with that. if you are looking for someone who is actually going to conduct that assessment, so look at the data, analyze the data, conduct focus groups or key informant interviews. I mentioned there are vendors to do that. HCI is certainly one of them. If you don't have the budget to do that, you might trade services, as I mentioned, with another local partner to help you with that. I think the benefit of having, if you have an HCI platform, the benefit of having an HCI consultant help you with the community health assessment is they have experience kind of integrating your platform data with your community health assessment so that you're really looking at the same data, and that gets complemented by the primary data collection they're doing through focus groups and interviews, and they have experience doing that. I think the other nice thing is that once you have your platform and that community health assessment, the platform can be a place that the data is updated. So as I mentioned at the top of the webinar, a lot of times the struggle is once your CHNA or your CHA is published, it's pretty much in that state for another 3 to 5 years. So the nice thing about the platform is if any data is getting updated, maybe even the next year or a couple months later, you can update that on the platform and refer to that. So it's a nice way to integrate your CHNA and your platform.
Great, thank you, Jane. We do have a couple more questions, and we are still a few more minutes left. Emily, who manages the data on HCI platform, and how regularly is it updated? And we also, Emily, I think you can help just answer about translation. Someone had asked about the translation as well. If you could maybe add that in your answer.
Site translation. Yeah, absolutely. So let me answer the data question first. Data on the HCI platform, who maintains it? So we have a dedicated research team made up of MPHers, epidemiologists, and those who studied that. And they maintain data across all of our sites. And they're constantly searching for, new data, updated data, et cetera. So that's who maintains the data that comes with the platform, the HCI platform. Of course, clients also who purchase the HCI platform have the ability to add their own local data. So we have tons of clients. The Hawaii site that I showed earlier in the presentation is an example of somebody who has taken full advantage of that. They've added hundreds of indicators of their own, and they maintain those themselves. We have clients who have, partner organizations who add local data and maintain it, or send it to somebody who can add it to the platform for them. When we're thinking about larger collaboratives who are having multiple partners who can share local data that they have access to that's not otherwise publicly available. And then as far as the data update timeline for the data that we at HCI for our research team, we are at the mercy of the data sources, of course, because we're using state and national level secondary data sources. So we work to update the data on the platforms as soon as the data source publishes new data. But of course, that takes some time on the back end as our research team kind of combs through that data and does a quality check of it before publishing it to all of our live sites. So I hope that sort of answers the data question. And then let me touch on it sounds like somebody was asking about the ability for a site or data platforms to be translated to a different language. We do have our sites work through Google Translation. So there is a huge amount of languages that can be chosen for any given site to be translated to. It's just a setting on the back end of our platforms. So yes, we can translate the dashboards and the sites.
Great, thank you, Emily. So we have 5 minutes left in the presentation or webinar. We did have one last question, and maybe Jane or Emily, if you could address it, just about it was regarding lesson 3, but bringing in and facilitating stakeholder engagement. And they were just asking about what kind of difficulties in your experience, have partners experienced in stakeholder engagement?
Yeah, maybe I can take that. And I'm really curious about, the types of challenges that the person asking might have come across. I think To begin with, it's really, in my experience, it's really about trust building. So one of the things that I love about the way our consulting team approaches stakeholder engagement is that we're really as out front as the client wants us to be, or as behind the scenes. So oftentimes the client has already built trust and relationships with the stakeholders that they'd like to engage. And I think that's where it really starts. So as you're thinking about these stakeholders, and that was, you know, one of my earlier points about, you know, thinking about what are the things that you can offer them. So I think a shared platform is a great place to start, because right off the bat, you have data on a platform that's going to engage the stakeholders, something that they might need for their grant writing, for their program development, something that you're offering them. So as you're thinking about engaging stakeholders, I think, you know, think about what you can offer them and how you can, you know, boost their messages and, you know, boost their mission, in addition to, you know, talking about the things that you might need. And as I mentioned, for your community health assessment or your community health planning process, think about who has the best relationships. That could be a single person that has the best relationship with that stakeholder that can build a bridge. You know, if you're using a consultant like HCI, that might be having still the client be out front, sending the emails, but maybe, you know, we're in the background helping you with how to develop those messages so that they resonate, and using the platform as a place to community engage your partners. But I think, you know, the one thing I would suggest is to build that bridge and offer something upfront in terms of stakeholder engagement. And Emily,
Great.
I don't know if you have anything to add to that.
No, I think that was great. I don't think I have anything more valuable than what you just covered there. That was a great answer. I hope that answers the question for whoever it was. And if we don't answer your question, of course, we can follow up after this webinar through email.
Absolutely. And thank you again, Jane and Emily, for your presentation today, and such valuable information. And so it looks like we were just about out of time. And of course, we want to make sure we know everyone's schedules are very busy. We've put our main contact email on the slide here, so please reach out with any questions that you may have on how we may be able to support you, your organization. For our current clients in attendance, please feel free to reach out to your account manager or your project manager if you have any questions following today's webinar. And with that, thank you again, everyone, for joining us today. And that concludes today's presentation. Have a great rest of your day.